welcome to our webinar brought to you by the Cancer Academy, Making Moves, Transforming Treatment Outcomes, a webinar on physical activity. My name is Stuart McKeon, and I'll be joined by Rachel Brown and David Bartlett in delivering this webinar to you today. This webinar has been pre-recorded for you to undertake in a way that is flexible to you. Please, if you're unsure on anything, please reach out to us via email with your questions. You can contact us on rsch.ssca@nhs.net. Be present with this session. If you're answering emails or working on something else, should you be here, reach out to us with an email if you are finding the topic difficult, if you would like some additional support, or just to chat about things. Take care and look after yourselves. For some of you on here, you may have first-hand experience with cancer, so apologies if this triggers some unpleasant memories. If you need to step away for 5 minutes at any point, then please do so. We recognise that cancer is an emotive topic for the majority of people. You should have that safety to be able to step back and compose yourself if needed. I've included some links that signpost you to available health and wellbeing support for you as staff, as well as patients and public. You may have seen this advertisement for this webinar through the Surrey and Sussex Cancer Alliance. Did you know that the Surrey and Sussex Cancer Alliance is made up of 3 ICBs, 7 acute trusts, and numerous primary and community sites? So not only are you part of your own organisation, but you're also part of a much wider network of cancer care providers delivering vital cancer care and support to our patients across Surrey, Sussex and Frimley. Alternatively, if you didn't hear about this through our SSCA communication channels, you have the opportunity to sign up to receive these. We have a regular monthly bulletin that provides information and resources on SSCA projects and news, South East and national updates, cancer awareness campaigns, training opportunities and support. To sign up, please scan the QR code or follow the instructions on the slide. This session aims to improve your understanding of the role of physical activity as an intervention for people with cancer. This course is ideally suited for all professionals at the following ascend levels of practice. It is our hope that by attending this course, you will be able to explain the benefits of physical activity before, during, and after cancer treatment, identify how motivational interviewing can support behaviour change in patients with cancer, demonstrate how to access appropriate UK-based resources for physical activity in order to signpost to patients affected by cancer, evaluate your own professional practice against the patient experience to identify one key behaviour change to apply moving forward. I shall hand over to Rachel Brown, who will talk to you about promoting physical activity.
Thank you very much, Stuart, and thank you for joining us as we talk through this webinar about physical activity and its role within cancer patients. And hopefully by the end of this webinar, as Stuart has said, you'll feel a little bit more confident about understanding why physical activity is an important component of cancer care throughout the cancer pathway. So let's begin by thinking a little bit about what is physical activity? What do we mean by physical activity? And what is its context within cancer care? So physical activity is any bodily movement produced by the skeletal muscles that require energy expenditure. So this is your normal day-to-day tasks, walking around during the day, household tasks, leisure activities, as I said, anything that's using energy to produce movement. What we know is that physical activity at a moderate and vigorous intensity have been shown to prove benefits to our health. So exercise as a term is a planned, structured and repetitive form of physical activity, a subcategory, if you will, aimed at improving or maintaining physical fitness. So whilst all exercise is a type of physical activity, it's worth remembering that not all physical activity is exercise. And why is that important? Well, I think it's really important when we're thinking about the terminology we're using with patients, because exercise as a word can be a little disconcerting to people. It can be a barrier in itself when people perhaps aren't used to exercising, or it's not something they enjoy doing, or it's not one of the values they hold. Whereas physical activity is something that most of us are doing at some point in some form during the day. And that gives us a window of opportunity when we're discussing physical activity and we're trying to engage people in it. So we do have some UK recommendations by the Chief Medical Officer about how physically active we as adults should be. Have a little think if you know some of the answers to this, but if we go to the next slide, we can talk through them. So we should be completing at least 150 minutes of moderate intensity physical activity each week. So this is activity that gets our breathing rate up, perhaps gets our heart rate up a little bit, but it remains a point where we're able to speak comfortably. So these may be things like brisk walking, cycling or swimming, or at least 75 minutes of more vigorous, higher intensity exercise or physical activity each week, where your breathing is faster, your heart rate is faster, and this sort of activity would be more difficult to speak through. So these are more your sporting activities like running or even going up and down the stairs at brisk pace. So aside from those types of activities, it's also recommended that we should be focusing on building our strength for at least 2 days a week. And that's important for keeping our muscles, bones and joints strong and healthy. Now, it may be that building strength can take the form of resistance exercises or weights in the gym or things like yoga, but it could also mean any activity that's loading the muscle, challenging the muscle, carrying heavy bags, heavy shopping also counts too. We should also be minimizing the sedentary time by breaking up periods of inactivity with frequent movement breaks. And for older adults, there's also focus on improving balance at least 2 days a week to reduce our risk of frailty and falls. So how physically active are we as a nation? If those are our recommendations, how many of us are actually achieving those? So firstly, what percentage of UK adults do we think are physically active in line with those guidelines? And a recent survey by Sport England showed that less than 64% of adults in the UK are meeting those recommendations. Children have their own set of guidelines specific to them, and it's thought that, or found that, less than 50% of children are meeting their recommended physical activity guidelines. So what about cancer patients? How many of those are meeting those Chief Medical Officer's guidelines in relation to physical activity? Well, very concerningly, it's estimated that less than 30% of patients with cancer or living with cancer or beyond cancer are meeting those recommendations. What I'd like to invite you to do is take a moment to have a think about why that might be. So, is it because they have a feeling that it's unsafe? Is it that no one's actually told them that it is safe and that they can complete physical activity? Perhaps they're experiencing side effects from their treatment that's making them feel like physical activity is unachievable or the last thing they're thinking about right now. Maybe they're sedentary before they started treatment and therefore being physically active or exercise isn't something that they're used to doing. Maybe they haven't been told about the benefits of physical activity and why it's so important and how it can impact their treatment outcomes potentially. So what are the specific recommendations for people living with and beyond cancer in relation to physical activity? Well, unless advised specifically otherwise, patients should be encouraged to follow the same physical activity guidelines for the general population. As a minimum, we should be encouraging all patients to avoid being sedentary or move little and often, and exercise can be safe during and after treatment as long as individual limitations are considered. But why does it matter, and why is it so important that we're having these conversations to encourage patients? Well, physical activity is important throughout the whole cancer care continuum in providing the physical and psychological benefits that we see. The research has shown that engaging in regular physical activity can improve treatment tolerance, can reduce treatment-related consequences long-term and the short-term side effects patients can experience, can maintain premorbid function and exercise capacity, and enhance patients' quality of life. There are lots of different benefits to keeping physically active before, during, and after cancer treatment. We know that patients who remain physically active improve their independence and confidence in living well after cancer treatment is finished. We also know that many anti-cancer treatments have an impact on our cardiovascular health, and therefore keeping physically active or improving physical activity after treatment can improve the health of our cardiovascular system. We know that being physically active, exercising can improve our mental health and well-being, facilitate our sleep, and being active, even in little small bursts during treatment, can help reduce fatigue, often associated with cancer and its treatments. It will improve our treatment tolerability improve focus, and give patients a feeling of empowerment during a time when so much is happening to them, whereas physical activity is something that they can very much be in control of. We know it's important to be physically active for our muscle strength. We know that treatments such as chemotherapy can induce or accelerate muscle wasting, contributing to cancer cachexia. Patients with depleted muscle mass present higher chemo-related toxicity and can have worse outcomes to patients who have better or greater lean body mass. So keeping our muscles strong and healthy is really important. Any weight-bearing exercise is important for our bone health and bone density, and being fitter and stronger before starting treatment can improve our recovery afterwards. Of course, being physically active will help maintain a healthy weight, and all of this is underpinned by behaviour change and making positive, healthy lifestyle choices as living with and beyond cancer. So where does physical activity sit? Where should it be in the cancer pathway? Well, physical activity should underpin the entire cancer pathway. You just may hear it talked about in different terms. Before treatment, you may hear the term prehabilitation, where physical activity makes up part of that process. Before treatment, preparing people for treatment. During treatment, physical activity may form part of rehabilitation, may still be prehabilitation, part of maintaining people. And after treatment, rehabilitation, physical activity alongside our long-term health benefits, and of course not forgetting patients who may be on a palliative treatment pathway, where physical activity also remains important, but may take a slightly different form. This is a nice graph you may be familiar with. It's often seen within the prehab space, but it gives a nice visual representation of the importance of prehabilitation and rehabilitation, of course, physical activity being a key component of those, for patients on their general health as they go through and move through the different phases of treatment, from diagnosis through to living with and beyond cancer. A patient who doesn't have the support or education around this, you can see on that lower line trajectory, could find themselves living with and beyond cancer in a worse general health condition than they were at their baseline, compared to a patient who has had support and education around prehabilitation and rehabilitation, finding themselves in a much better position with their general health, living with and beyond cancer. So let's just focus a little bit more on prehabilitation itself. So prehab being preparation before treatment of our bodies to get them strong, both in terms of our physical health, but also our psychological health and well-being. And prehab is combined of three main areas or three main pillars, and they are physical activity, nutritional optimization, and psychological support. And those elements together benefit patients in terms of optimizing them before treatment starts to enhance people's ability to tolerate and recover from treatment. We know from the guidelines that prehab should begin at the point of diagnosis before starting treatment. And whilst benefits can be seen as little as 2 weeks, the longer patients have that intervention, the greater the outcomes and successes will be. So what about beyond prehab? Is it safe to be physically active during treatment? The answer is yes. There's much more research occurring now into this field, and research has shown that exercise is safe, helpful, and possible for many patients and people with cancer. The general advice, particularly for someone who isn't very active normally, is to start slow and build up gradually. But also, some patients may be very physically active or engaging in sporting activities before their diagnosis. And there's no reason why people shouldn't be encouraged to continue doing the things they enjoy and being active, which can have huge benefits for their mental health as well as their physical health. We, of course, need to consider considerations that may impact someone's ability to exercise. For instance, nutrition. If somebody is nutritionally depleted and not meeting their calorific intake, then exercising is going to be difficult and needs to be done in conjunction with the dietetic departments. Some patients may find that treatment side effects make it difficult for them to be physically active, such as fatigue. Patients experiencing peripheral neuropathy, if it's profound, can impact their balance. It's not to say that they shouldn't be physically active, but may need some more specific guidance around how to do that safely. And similarly, patients who have adjuncts like PICC lines, again, may need some more specific guidance around what they can and can't do. So how does it help? Being active during treatment helps maintain physical function. It's been shown to help reduce cancer-related fatigue and improve tolerability of treatment. And as we've already discussed, can be really helpful in improving or supporting patients' mental well-being. Evidence suggests that exercise may contribute to better treatment outcomes as the body is stronger and better prepared, including improved tumour regression and immune function. You're going to hear a little bit more about this from David shortly. There are long-term benefits to keeping physically active after cancer treatment. We know that so many cancer treatments can have long-term and late effects on our bodies, and keeping physically active can help mitigate the impact of some of those. Being physically active will improve and assist our bone health, keeping our cardiovascular system healthy. Of course, being physically active will help in terms of reducing risk of obesity and diabetes. But more compelling, the research is growing in this field that shows that actually being physically active can reduce cancers of the bowel, breast, and endometrium. And there are studies now being produced that show that physically active cancer survivors have a lower risk of recurrence of breast, colorectal, and prostate cancer, which is hugely empowering for patients to know. Just like to draw your attention to a research study that was published over the summer, which was the first randomized controlled trial looking at the benefits of physical activity. And this was in colorectal cancer patients that have finished adjuvant chemotherapy. Patients were either given structured exercise or health education over a 3-year period. And what they found was that the structured exercise group had a 28% lower risk of disease recurrence and a 37% lower risk of death. And there's a QR code there for you, and I would encourage you to go and have a look at this journal because it's got some brilliant results attached to it. I'm now going to hand you over to Dr. David Bartlett, who is a Senior Lecturer of Exercise Immunology at the University of Surrey, who is going to talk you through more around the science around why physical activity is so important in the cancer population.
Thanks, Rachel, and hello everyone. Yeah, so I'm going to give you a little bit of a chat about how exercise works, and really try to focus in on some of what these mechanisms might be, because if we can understand what the mechanisms are, then perhaps we can make physical activity and exercise work even better in the cancer journey. And at the moment we have these lovely guidelines, but we always want to try and improve them a little bit. So as Rachel alluded to, people on the cancer journey tend to be a heck of a lot less fit than those people who don't have cancer. And I hope you'll appreciate these figures, which show that in the blue you have people before treatment, during treatment, after treatment, and those who are under metastatic. Compared to their age-matched healthy people, they are around about 30% less fit. And the consequence of this is that survival is much lower in the least fit people. So on the right-hand side, this is your typical Kaplan-Meier survival curve, and we have people in blue who are the least fit patients with cancer, and people in yellow who are the higher fitness, and the further right the line goes, the longer they survive. And so generally speaking, the fitter you are on your cancer journey, the longer you're going to survive. And we know that some of those underlying mechanisms are related to energy redistribution. Tumors are getting bigger, but at the same time you're receiving therapy, and this causes the fatigue and requires energy to work. And ultimately, what we see is that the immune system has failed because the cancer is taking over, and the therapies are trying to reinvigorate the immune system to be able to fight it. And what we know is we can think about the relationship between your immune system and your physical fitness, kind of like this. And so this is your age on the bottom, this is your physical fitness on the right, which can go down, and your immune system and your resilience to stressors on the left-hand side. And so in a normal circumstance, people usually hit about 70, 75, 80 years old, and then their physical fitness really starts to decline quite rapidly, and they move into these states where they're unable to deal with stress, and their ability to recover from the stress is impaired. And at this point here, their physical fitness is low, but their immune system is low as well. And so the two of them kind of work hand in hand. When we have people who are physically active all the time, they're kind of like our positive population. They're out doing marathons and crazy competitions all their life. And those people have what we call a physical fitness and an immune health that is about 20 years younger, and they tend not to experience these rapid declines that you typically see with aging. But of course, when we're talking about cancer, we get this cancer diagnosis that occurs, and I'm sure you'll all appreciate that as soon as this happens, you see this rapid reduction in physical fitness, ability to deal with stressors, and alongside that comes a poor immune system because it's failed to take control of the cancer. And the big question that you can take away from this figure and the one before, where we're looking at survival, is how do we get those people off of that red line and back towards that purple line? And if we can we get them to the green line so that they can hopefully get through their cancer journey much better? Well, what we know is that if there's a relationship between physical fitness and immune function, then we can hopefully exercise the immune system to be able to improve some of these outcomes. So I'm going to give you a little bit of a talk about the immune system. I understand that it's a complex topic, and so we'll try to keep it as simple as possible. But this is kind of what it looks like. This is what we call cancer immunoediting. And the main thing that you want to figure out here is that you have in these grey cells, these grey figures are all of your tumour cells, and all surrounding it are immune cells, which would typically be able to identify and destroy your tumour growth. But as time goes on, the immune system has changed, the tumour starts to get bigger, and you move into these stages of equilibrium and escape. And at this point, the immune system has failed and is unable to control the cancer, and so it takes over. And so, yeah, that can be a pretty complex idea. So to make it a little bit simpler, let's think of really easy analogies that you would be able to kind of feed back to your patients and to your population that you're speaking to. And on the left-hand side, you have your typical cancers, and on the right-hand side here, you have your typical immune cells that are split into different components. And the best way that I like to think about this is using Star Wars analogies, because that's kind of the era I'm from. And if we think of it like this, then you would assume then that you have Darth Vader in the middle on the dark side of the Force, and all of his minions who propagate the dark side, and in this case the tumour progression, are all in there. And on the right-hand side, you have the rebellion or the resistance, and that consists of all the prominent figures of Star Wars, including some of these figures that are involved in tumour destruction that we can call Jedi. The Jedi fighters at this point. And really what it's all about is, if you are doing no exercise and low physical fitness, then you can imagine it kind of tilting towards the dark side and the tumour progression. But I'm going to show you some evidence in a second that suggests that if you're doing lots of exercise and you've got good physical fitness, then it should start to go towards the good side. And it's propagated by your immune system being beneficially changed by being physically active. And some of those cells that we really want to kind of focus on, and I'm going to highlight these pictures as we go through some of the data, are these Jedi fighters in the case of Luke Skywalker and Obi-Wan Kenobi and so on. So how does exercise and the immune system work together? Well, we've known this for quite a while from the general population, and what we know is that every single time that you go out to do some sort of exercise where you increase your heart rate, you increase your breathing rate, and you've got active muscles working, causes a mobilization of immune cells into the blood. And so this figure up here shows this really nice, where you start exercising, you have a release of catecholamines, your heart rate goes up, and you get this preferential mobilization of NK cells and T cells, two cell types that are absolutely critical to being able to identify and destroy tumors. And so if they're moving into the blood, why is that happening? Well, it's happening because your body thinks that you're under a pathogenic challenge. You know, when you have the flu, your body raises its temperature, increases its heart rate, and it mobilizes cells to be able to fight the infection. Exercise does the same thing, but it's a sterile challenge. And so as soon as the exercise finishes, those immune cells all go back to where they came from, but they're ready for it the next time. And so every repeated bout of exercise primes your immune system ready for the next one. What we've done in the lab before is that we've taken those cells that are mobilized into the blood, and we've asked them to kill cancer cells. And so on the bottom here, you can see that immediately after exercise, there's more cancer killing compared to what there was before. And then as the immune cells all go back to where they came from, the cancer killing goes back to normal. But this figure over on the bottom right shows that actually what happens is that your immune system leaves cells in the blood much better able to identify and kill cancer cells. And it's not just the immune system, it's a really nice combination of your working muscle, which releases these cytokines or myokines that are in the blood as well, that all help to prime the immune system. And so if this is happening in every single time you do some exercise over a period of weeks, where you're trying to get fitter and fitter, this is happening all the time, and it's preparing your immune system for any kind of pathogenic challenge. So then what happens if you have cancer, right? Well, this seminal paper by Pernille Holman's group in Denmark was one of the first to really show what the mechanisms of exercise in cancer might be. And so she took mice and asked them to go on their little running wheel for 30 days. She gave them cancer, and then she tried to figure out how much the exercise was impacting the cancer growth. And so you can see here on the left-hand side, this is the tumour volume. The exercise mice have a significantly lower tumour volume, so it's reducing the amount of tumour that's there. And then this is the number of tumours, and you can again see that the exercise has a significantly lower amount of tumours within the lung in this case. And using pictures of the tissues, hopefully you can appreciate that on the left-hand side here you have control mice, and all of this black is tumour. And on the right-hand side, you have the same exercise mice, but now you have much less of the tumour that's in there. And the key to this is that the exercise during every single session was mobilising these immune cells. And so in this case, we've got some of these Jedis, and we can see that really nicely here, that the exercise was causing more immune cells moving into the tumour. And in this case, you have these T cells and these NK cells all moving into the tumour that is then able to identify and destroy the cancer from within. It's almost like the exercise is working similar to an immunotherapy, and in this case there was no treatment, but we now believe that we can actually use exercise as a type of an immune enhancement within cancer. So that's mice, and sometimes mice studies and mouse studies don't really translate to humans. So what do we have that can help us understand in humans? Well, fortunately we have, and here in Surrey we've just completed a study, and we have an ongoing study where we're looking at prehabilitation in esophageal cancer patients. So these patients are on the prehabilitation pathway because we need to get them fitter before surgery. So they have about 16 weeks from diagnosis until surgery. They have about 8 weeks of that where they're receiving neoadjuvant chemotherapy, and then they have about 8 weeks where they're recovering from their neoadjuvant chemotherapy. And in this study, we exercised them for the whole of the 16 weeks, and we really wanted to try and improve their fitness, but at the same time, we want to try and figure out what was going on in their tumours. And so on the left-hand side, you have the controls, and then on the right-hand side, you have the patients who have went through the exercise. And you can see all of this lovely cyan blue colour. This is all your tumours. And I hope you can appreciate that on the right-hand side there, you have a lot of these little red dots spattered around in the tissue. And these little red dots are NK cells and CD8 positive lymphocytes, those cells that are absolutely critical being able to identify and kill your tumours. When we graph this, we can see that exercise population has about 3 to 5% of their cells are lymphocytes that are killing the tumour, and that's about double what you would have in the population that didn't get any exercise, which is great, right? And so that kind of gives us the indication that exercise is promoting an influx of these immune cells into the tumours. We looked at it a little bit further, and this is where it really kind of gets interesting, because now we have our tumour on the right-hand side, and we have this little clump of immune cells, and these are called tertiary lymphoid structures. And they are an indication that the systemic immune system has started to understand that there is a tumour there, and it needs to be able to mobilise cells into the area to be able to provide some sort of pathogenic fight against it. But fascinatingly, what we found is that the fitter the patients became, the more of this immune response we got. And that kind of implies that if you can take patients through a prehabilitation program and improve their fitness more, can it actually increase the amount of lymphocytes in the tumours to the extent where you've changed the tumour microenvironment enough that you're actually destroying the tumour? And so this was our pilot study, and we've opened this second trial now, where we're trying to figure out what the dose response of exercise is, because like we mentioned earlier, general prescription of exercise might not be specific. And so if we can take the approach in a much more specific, mechanistic focused approach, can we get rid of the tumours altogether? And some of our preliminary data is suggesting that is actually what's happening. So each bout of exercise that you do will contribute to an improved anti-cancer effect. And this is the kind of mechanism that we work with. This is the underlying hypothesis that we're going, where we have this mobilization of immune cells into the blood. We have interactions between the endocrine system, the catecholamines that are going, the inflammatory system, the muscle, all working together to be able to impact what's going on in the tumour. And so with that, I am going to stop there, and I'm going to pass over to Stuart, and Stuart's going to explain to us about how we can motivate patients to be able to exercise.
Thank you, David. So now we've heard about the science behind physical activity and cancer. I'm now going to talk about how we can support patients to help increase physical activity. So I'm going to start by just opening out a question. So what are some of the barriers to behaviour change? Because potentially that's what we're asking our patients to do. If physical activity isn't something that is part of their day-to-day activity, we are asking them to change their behaviour, and that can be difficult. Some of the barriers that they might experience are misconceptions about cancer, about treatment, and what they can and can't do while they're undergoing treatment. They may experience low motivation, or what we call an ambivalence. So they may not see the immediate benefit, or they may not see the longer term benefit. And actually getting past that barrier can be quite challenging. They may experience fear and anxiety associated with physical activity, the change itself, the misconception in their minds that it may increase side effects, it may cause more injury. There may be sort of barriers that we as clinicians face. So actually limited consultation time to actually have a meaningful discussion to talk about the benefits of physical activity. We may have insufficient training and actually a lack of confidence in recommending physical activity, insufficient access to specialist support to help behaviour change and to increase physical activity. It may be that there are constraints. So there may be that actual work commitments. It may be that actually the cost may limit one's ability to access services, to access support to make that change. All of these barriers that we've identified can be grouped into specific components. This is identified here in what's called the Cone-B model. So the Cone-B model essentially states that to make a sustained behaviour change, one needs to have the capability, the opportunity, and the motivation. One must be psychologically and physically capable to do so. They must have the social and physical opportunity to do so, and they must have that desire or the need to carry out that behaviour, or otherwise be motivated to do so. So we're going to break down this model into a little bit more detail just to understand what we mean by capability, opportunity, and motivation. Capability essentially relates to the psychological capability, so one's knowledge, psychological strength, skills, or stamina to be able to do something, or the physical capability, so that physical strength or that stamina to be able to physically carry out the behaviour. The opportunity is referring to external factors which make the execution of that behaviour possible. So again, physical opportunity. So opportunities that are provided by the environment, such as your time, location, and the resource available. Your social opportunity. So opportunities as a result of social factors. So looking at people's cultural norms and social cues. Finally, motivation is referring to the internal processes which influence decision-making and behaviours. The two components that make up this are reflective motivation. So reflective processes, so you're making plans, evaluating things that have already happened, versus your automatic motivation. So automatic processes, your desires, your impulses, and your inhibition. As these components interact, interventions must target one or more of these to enact and maintain effective behaviour change. How can we support behaviour change, thinking back to this model? Motivational interviewing is a technique that all healthcare professionals should be utilising in order to make behaviour change. Has anyone heard of motivational interviewing before? Is it a term that you've come across? Motivational interviewing is a person-centred counselling method for addressing the common problem of ambivalence about change. This was initially an approach to address alcohol misuse, but it was found to have wide applications within healthcare, and it has been extended to other behavioural domains such as smoking cessation and physical activity promotion. Now, there are lots of different motivational interviewing techniques that we can use as healthcare professionals, such as DARN-CAT. You've got PACE, you've got RULE. For the purpose of this webinar, we're going to look at the OARS model. The OARS model has 4 key components within it: open questions, affirmations, reflective listening, and summarising. So it's a really nice, easy model to grasp. Now, we're going to look at the OARS model in a bit more detail. We're going to break it down and understand what we mean by each of those components. So we'll begin with open questions. Now, the purpose of open questions is to invite the patient to share their thoughts and feelings in their own words. And by doing so, you as healthcare practitioners have the opportunity to potentially uncover deeper concerns that the patient might have. The open questioning allows the patient to tell their story. Asking open questions helps you to gain an insight into their way of thinking. It allows you to facilitate the dialogue from there as well. You're not necessarily having to commit to a particular response or a viewpoint. Examples of open questions. Can you tell me your thoughts on exercise and physical activity? How do you feel about being more physically active? So we're now going to go on to affirmations. So the purpose of affirmations is to recognise strengths and values. It's to help build rapport and reinforce that positive self-image. It can be difficult to discern an affirmation from a compliment. An affirmation is emphasising their current strengths, their past successes, and their recognition of their efforts to take steps, regardless of how small they are. To ensure that affirmations remain patient-focused, it's important that you use you statements and not I statements. So, for example, instead of saying, I'm proud of you for beginning physical activity, which focuses it more on you as the healthcare provider than the patient, you could say, you've worked really hard to get into the position where you are increasing physical activity in your day-to-day routine. Other statements that you can use: you're someone who doesn't give up easily. Your persistence is a real strength. It sounds like you found ways to be active in the past, which shows that you can be successful with this too. Getting out for a short walk, even once, is a real achievement. Reflective listening. There are several reflective listening responses that range from simple, so you're repeating or rephrasing a person's statement, to more complex, so you're using different words to contextualize that to show that you're listening. These reflections show that actually you're genuinely interested in understanding what their perspective is, or you're trying to understand in your own words what it is they're trying to get across. These reflections allow that deeper self-exploration of the patients. You're not just nodding, you're not just being quiet, you're not just maintaining that eye contact. You're trying to contextualize what it is that they have said, put it into your own words, develop that into a hypothesis, so to speak, and then you're rephrasing this back to make sure that actually you've understood what it is that they're trying to get across and you've interpreted that correctly. There are 12 roadblocks. Any one of these roadblocks that you encounter means that you're not reflectively listening to your patient. And finally, we look at summarising. To summarise is to consolidate the key points of your interaction, to demonstrate your understanding, and to set up that collaborative decision making. At the end of the summary, it's also important to check back to ensure that you haven't left anything out. It also allows the other person, the patient, to add additional bits to this summary or to correct any statements or final sort of summarization that may not reflect the purpose of the conversation. The summaries will reinforce the key statements and will begin that movement towards change. I'm now going to hand back over to Rachel and to David for some key takeaways.
Thank you, Stuart. Some really interesting points to help draw together everything that we've talked about so far and how we put that into clinical practice. So as we start drawing this webinar to a close, I hope you found all the content interesting and thought-provoking. And David, if you don't mind, if I could ask you a couple of questions, which I think would be really helpful for healthcare professionals and support workers in relation to the fascinating research that you talked about. So the science is really compelling, actually, and very, very insightful. And I wonder, how do we relate those findings to patients in a way that is accessible and empowering that healthcare professionals can use in their daily practice?
Yeah, thanks, Rachel. That's a great question. I think it's a really important point to get across because we can carry on telling people over and over again that you need to be physically active. It's going to make you stronger and it's going to make the journey easier. But I think when you start to get the message across that every single time you're doing some sort of exercise is impacting your cancer literally at the tumor, then I think that really kind of emphasizes the strength of what's going on. And if you're able to kind of go back to a Star Wars story or some sort of other analogy that would help you to explain every single time this is happening, your immune system is fighting the battle, and every time you keep doing the exercise means that your immune system is starting to win the battle. That's a strong message to get across. I like to use pictures. In our lab we have lovely pictures of these tumors. We have lovely pictures of the immune system. But if you don't have pictures, then you can kind of go back to your Star Wars story and really try to get that across. But it's the most important part is that it's every single time, it's every single bout. And every single bout of exercise causes this immune mobilization that then helps to fight the cancer.
Yeah, really important. And in terms of the type of exercise, do you have any thoughts around what we should be advising people? Should we be focusing on cardiovascular exercise? Should we be focusing on strength and muscle power and resistance exercise? What does the science say around that?
Yeah, so that's a great question. And the science of the last guidelines all kind of fit towards that cookie cutter approach where we've got this 75 to 150 minutes of vigorous intensity exercise with the 2 sessions of resistance training. But I think over the last sort of 7 years or so now, we've started to figure out that exercise can become much more specific, and it is much more individualized to each individual person and each individual cancer. And so the personalization of exercise means that although we're aiming for those guidelines, it may well be that you have to focus on aerobic capacity or aerobic fitness depending on what the journey is that they're on. So for example, if you've only got a few weeks until surgery or cancer surgery, then you know what their fitness is. Can you personalize it specifically towards that patient becoming fitter for their surgery through aerobic exercise? So it's a complex question. There's no simple answer to it, but it takes us down the rabbit hole of personalization, and I think everybody needs to understand what personalization really means. I suppose that means then I should ask you a question, Rachel, if that's okay, because I go down this personalization route, but what does that look like for you in clinical practice? How can you get that across to your colleagues about how you would approach that?
And I think that's key because personalisation is so important. And it's also part of the journey of getting patients on board as well, isn't it? Because, an elderly, frail patient isn't going to be able to go out running and doing, really high intensity exercise. So it's looking at what's realistic, but it's also tapping into using those opportunities and those teachable moments. And I think those are what we see as the most powerful in practice. Actually, a lot of the time, it's giving people permission to be physically active at a time when they've kind of decided themselves that perhaps they shouldn't be, or no one's had that conversation. So even your patients who are really fit and active, I've seen stop doing anything completely when they've embarked upon their cancer treatment journey. That empowerment of saying, actually, you can continue and it is safe to do so. And by the way, these are the reasons why. And having that toolkit for professionals, which hopefully information that we've covered today will improve on the confidence of people to actually have those conversations and not shy away from them, are really important. It's that one voice approach. And that's something I'm really passionate about, is that it's not one person's responsibility to be tackling this conversation or this topic with patients. It's something that all of us should be discussing with patients in a confident manner, using those teachable moments and documenting it as well. We're not very good at that always, so that everyone is singing off the same hymn sheet, as it were, in terms of encouraging patients, using those interests that are already there. And that's where talking about terminology, I think, is really important. That using physical activity rather than exercise might be a way in and overcoming some barriers for some patients, and aligning it with their interests where possible too. But absolutely, personalisation is key. So if we just recount our sort of key takeaways today, hopefully you all feel confident now in understanding what the benefits are of telling patients or encouraging patients to be physically active and having those conversations, and advise them to start slowly and build up gradually if they're not already active. If they are already active, then encourage them to continue, reassure them that there may be up and down days, and that's okay. It's about activity modification and pacing where need be, but general advice is to not stop altogether. So patients who are unfortunate enough to feel unwell during parts of their treatment, perhaps, something still counts as something. Walking around, pottering around the garden, going up and down the stairs, they still count as physical activity, and should be encouraged as such. And of course, there will always be more complex patients that we come across where you will need to require or seek some advice from appropriately trained professionals, or need the input of the medical team and oncology team. For example, patients with complex bone cancers or metastases. Those with very profound peripheral neuropathy may have challenges with their balance, and so we may just need to be a bit more careful around the types of exercise we give, perhaps more seated exercise. And any patient who has quite profound cardiac compromise, again, will need to be done in consideration alongside the medical teams too. Overcoming barriers, as Stuart has very nicely talked about, with some really good tips around the conversations we're having, the types of questioning to be asking patients, and as we've already mentioned, that those normal daily tasks also count. Gardening, going up and down the stairs, even walking around the supermarket, walking to get the paper, all count as a starting point. And we do have resources which will accompany this webinar, which will hopefully be very helpful for you. We have resources to support healthcare professionals, but we also have resources that are for patients. There's a brilliant physical activity book that Macmillan have made, and they are free for healthcare professionals to order and give out to their patients. So there is a wealth of information out there. The Surrey and Sussex Cancer Alliance webpage also has a physical activity hub on it with links to some resources too. But what we'd just like to quickly share with you now, we've talked a lot at you over the past some time, but we'd like you to hear from a patient. So this is a patient who experienced prehabilitation and rehabilitation. It was a patient who had cancer surgery, and they're going to share their thoughts on what they felt around physical activity being part of their treatment approach.
My name's Charles. I'm 77, believe it or not, and it was November 22 that I woke up and urinated blood, went to A&E, didn't get very good treatment, unfortunately, was sent home again. Happened again 2 weeks later, went to A&E, saw a lovely doctor who sent me straight up for a scan. And that was diagnosed as bladder cancer. I had BCG treatment and lots of bladder scrapes, which were not very pleasant, for over a year, and it didn't work. I was sent to Frimley because they had a new advanced form of treatment there, but I was told I couldn't have it because the cancer tumours were sort of in the urethra. So there was no choice but to have the bladder and prostate out, which happened in May last year, 24. Probably about 6 weeks before, I got an email from you guys asking me if I wanted to do the prehab sessions in the gym, which I leapt at. Yeah, I mean, I've always played tennis, which I still do. I like walking. I cycle a bit, although the roads around here are a bit hairy. So yeah, I mean, and I do gardening and general things that an old man does. Yeah. Went on all the machines here, rowing machine, arm bike, just everything that's in the gym here, yeah. The physios, Zoe and Neem, were absolutely brilliant, but they didn't half push you in a very gentle way. But yeah, So the difference between the beginning and the end was quite remarkable. I mean, pre-op, I don't think I had any challenges. It was just a question of getting stronger and doing things better. Yeah, you know, because I've always been relatively active, so. Absolutely, 100%. I recovered very quickly. I was kicked out of here quite quickly, but went to stay with my daughter, and you know, within a couple of days I was out walking and, you know, doing things that I was told I should do, yeah, without overdoing it. Yes, I have. I did, you know, the post-op physio here, and I was encouraged to carry on, so I was advised to take up Pilates, which I've done, and I do that every week now because that strengthens the core, which I needed strengthening after having bits removed. So I do that every week. I'm still playing tennis and still walking and cycling. The only thing that not quite so good is swimming. There's a slight touch of embarrassment with a bag, but one gets used to it. Come here. If you're invited to come here and do as many sessions as you can, because it's really beneficial. Aids recovery, and after the op, builds up your strength. You know, it's, can't praise it enough. Not at all. I still enjoy a good quality of life. I still do things that I did before, and with the Pilates, probably a bit stronger and a bit better than I was before. So yeah. That it's important to be physically active before an operation and to get as strong as you can, because that just, you know, gets you through it better and aids recovery, and to keep at it afterwards. I mean, I just think this is amazing. I had no idea when I sort of had all the pre-op treatment that this gym was here. You know, and I've been to the Royal Surrey for years because my wife was in here with cancer and we didn't know about it then, or maybe it wasn't around then, but yeah, it needs publicising in a big way.
Lovely. So all that's really left now is for all of you to have a think about all the information we have shared and discussed today. And what I'd really encourage you to do is think about how you're going to take this information forwards. Think about one thing you have learnt, or one thing that's really resonated or stuck with you today, and think about how you're going to implement physical activity, counselling, advice into your clinical practice going forwards. And remember to document it too. So there are ways of doing that. On Somerset, there is a physical activity marker you can check. The more people that we have along the patient's journey, talking to them about physical activity with that one voice approach is going to really benefit and help. And I'd like to just finish, as I always do, with the wise words of Professor Dame Sally Davies, who gives us a lovely quote that if physical activity were a drug, we'd refer to it as a miracle cure due to the great many illnesses it can prevent and help treat. So we will part on those wise words. Thank you for joining us.